Hello, I am Banu Segar here. Today I am going to explain on the dangers of the mismatched blood transfusion. There are two major categories for blood transfusion reactions. One is immune mediated and the other one is non-immune mediated. Immune mediated reactions include all cellular and humoral responses to blood. Non-immune mediated reactions includes volume overload, electrolyte abnormalities and hypothermia and others. Acute hemolytic reaction is an immune-mediated event. It occurs within 24 hours of a transfusion due to ABO compatibility, which is also known as mismatched blood transfusion. When the mismatch occurs, the recipient's body destroys the transfused red blood cells. It's because immune system attacks the donated blood cells which causes them to burst, leading to low blood pressure and kidney failure. Little as 1 ounce compatible blood can be fatal. This reaction starts as general discomfort or anxiety during or immediately after the transfusion. Other symptoms of mismatched blood transfusion are fever, chills, chest pain, back pain, hemorrhage, increased heart rate, shortness of breath, rapid drop in blood pressure, which leads to shock, renal failure, and potentially death. Common reason for an ABO mismatch transfusion. Human error is the most likely cause for a mismatch transfusion. Mislabeled blood, incorrectly completed forms, failure to check donated blood before transfusion is what results in wrong blood type for transfusion. Mismatched blood transfusion treatment, which is the plasma exchange therapy, results in the removal of anti-A or anti-B antibodies and the removal of free hemoglobin. The removal of anti-A or anti-B antibodies can inhibit the antigen-antibody reaction. Prevention. The provider who is administering the blood transfusion must check the patient's hospital-issued wristband and identification number against the information listed on each blood product prior to administration. Patient should be reassessed and vital signs should be documented 15 minutes after the blood transfusion process started to ensure that they are not becoming febrile, hemodynamically unstable, or have complaints of itching, flank pain, chills, or other signs and symptoms. If the reaction is suspected, blood products should be stopped and appropriate treatment should be taken.